Greetings, this is MK, and on today's video we are going to look at how to set up a minimalist physiotherapy clinic. So all physiotherapists generally face the challenge of space, and in this video we will try to see how we can maximize the space, especially for a musculoskeletal physiotherapy practice in particular, and in general all other kind of practice. Alright, so this is my clinic. Generally this clinic is only around 180 to 200 square feet. So in this clinic, the first portion of my clinic, what you can see is my desk. So I do not like to have a large desk. We are not conducting any administrative works or anything, so I prefer to have a very small desk for my intake. So just a small desk where I can work on my laptop, get my forms, and also to get my patient intake and my subjective going. And I have all my assessment stuffs all stacked up in a small area. So this will help provide me larger space in a small clinic, so that I don't need to fill up that space. And if you see our mat, our flooring is a rubber type of flooring, so that we can have an anti-slip features. And also since we are doing a lot of exercise in our clinics, it will be helpful for preventing any kind of slippage or any kind of non-friction areas. Alright, so at the corners I just keep my electrotherapy equipments, though I do not use much of it, but we will just stack in the corner, and that space is being used up for that. Right, my second most important area is my education board. I like this to keep a whiteboard, a huge whiteboard. So this will allow me to explain to patients, for example, by using diagrams to help explain to them on their diagnosis, their prognosis, and I can write up whatever I want and to explain to them. I can even, I do not need to also put up all these posters on the wall. I can keep changing posters to explain to them about knee injuries, and if I need to explain other things, I just can bring and just post up everything. And this board also helps me to fix other things. So when I use for things like proprioceptive work, joint position error and all that, I can use charts like this. I do use charts, so you can just fix up any kind of charts here, right? So my neurocognitive charts can be fixed up. So this board, a simple board as a whiteboard, will be very efficient for your clinic to explain patient, as an education board, and also for a treatment board. All right, and on these corners, and if you see here, I do not have a static bed with all those electronic things, because I prefer not to have that. I prefer to have a portable bed which I can just roll up and just put it in a corner, because most of the thing which I do, generally the first thing will be the assessment. Once I'm done with all my assessments, so the whole space I'm going to use it for my exercise session or for any other neuromuscular work or any other work, right? So you don't need actually a huge assessment table or a static table if you have a small clinic, because it will fill up those spaces. The third thing I have here is I just fixed up a acrylic board here. This acrylic board, the advantages are you can do many things here with this acrylic board. So you can have your proprioceptive work done here. So you can see that I have fixed all this. So this is basically to fix blaze boards, where you can do reactive trainings with single legs and all those things. You can also use markers. You can put numbers, You can use markers, put numbers, and do all those kind of works. You can add in things like for shoulder mobilization. So I get my frozen shoulders to do work on these smooth surfaces. So this is a good board, an acrylic board, which you can fix on your wall, and you can do many things in a single board. Right? And if you come here, we have some of the neuromuscular therapy equipment. So I keep all my wobble boards, my rocker boards, my balance pads around here. I do have a parallel. This parallel is quite effective. So it's quite light. So it's quite very easy to do all your shoulder works. So if you want to do dips, you can do dips, and all kind of exercises can be performed. It's easily mobile, and you can bring it, and you can use it also for as a board, a support in case you want to do like single leg standing and they're quite old and they need support, more support. So you can use it as a support also for neuromuscular training. So these are quite mobile, and you can just stack them anywhere you want in the room. So you see here, we have a huge space to do exercises in these places. So you can have cones, you can stack up cones to do your neuromuscular training. So going for balance training, you can do all kinds of training if you have a large space and you don't stack up with equipments which are actually not that necessary. So you can do ball training on all these areas, right? So the second thing for weights, I try to maximize. So this is called a Y-bell. So I try to maximize my weights through these kind of multi-purpose things. So Y-bell, it has an option of using it like a dumbbell. All right, you can use it as a medicine, just like similar to a medicine ball when you want to do a squats and all that. And you can use it like a kettlebell, right? You can use it like a kettlebell. So, and also it has things like to hold for doing push-ups, right? So you can maximize with this kind of weight equipments, so that you don't need to have stack up lots of equipments. So it comes in different sizes from 6 kgs, 4 kgs, up to 12 kgs, and it's quite useful to do rehab in a small space with all these equipments. The other thing we have are weighted bars. These weighted bars are quite useful. So this is around 3 kg. So these bars will be helpful for doing shoulder exercises, right? Or presses. So all these weighted bars doesn't take up much space, but still quite useful for your exercise programs. All right. So, and I also do have here bands, quite thick bands, which we can use. And if you see here, I have just a slight ring there fixed, so that I can do many things with that. So from doing biceps practice, or any leg work. You can do leg works. So this is quite useful. And if you have the table, you can even do seated quadriceps. So you can fix many therabands or any kind of thera loops in this. So it's quite useful to have these kind of rings, so that you will be able to do all these exercises with resistant bands and all that. All right. And in what else I have in my clinic, I have a blood flow restriction training equipments, which I use for strengthening to maximize strength with a low rate, low load, because most of the patient, if you're in a small clinic and if you're not in a gym setup, it's going to be doing in a low load system initially. So we have blood flow restriction training. I've arranged everything, all my bands and everything in a single space so that I can maximize my whole space. So what you need to do if you're a startup, if you're a new physiotherapist and you want to set up a clinic, is do not go for large equipments like a treatment table which is large, or even a table which is large. Try to maximize your space so that you'll be able to achieve maximum outcome for your patient through exercise therapy, your neuromuscular control work, and many other core works. When you're going for low back pain, you can just put a mat down there and start doing your core work because you have this amount of space. This is just a small room, around 180 square feet of room, but I'm able to do most of my rehabilitation in this room itself. And depending on similar thing, if you're a neurological physio, you might need a certain thing. So try to think of how you can maximize your clinic and not clutter it with too many things, and basically to have a better outcome through your practice, you need to choose your equipments wisely in such a way that it is not too many, but something similar to what, like these Y bells, where you can maximize 3 or 4 components in a single equipment. Thank you very much, and we will see you next in our next video, where I will show you my larger rehab space, on how to set up a rehab space for sports rehab and returning patients to sports kind of stuffs which we can use in our rehabilitation practice. Thank you.